What is Orlynvah? Orlynvah tablets are used to treat uncomplicated urinary tract infections uUTI, caused by specific bacteria, in adult women with limited other antibacterial options. Orlynvah contains Sulopenem Etzadroxil, a Penem antibiotic, and Probenecid, which increases blood concentrations of Sulopenem. Sulopenem belongs to the Penem class of antibacterials, which works against bacteria infections resistant to specific antibiotics. Orlynvah FDA approval is for the treatment of uncomplicated urinary tract infections caused by the bacteria Escherichia coli, Klebsiella pneumoniae, or Proteus mirabilis in adult women who have limited or no alternative oral antibacterial treatment options. FDA approval was based on positive results of Phase 3 clinical trial REASSURE, which compared Orlynvah to ciprofloxacin, and REASSURE, which compared Orlynvah with Augmentin amoxicillin clavulinate in adult women with uUTI. Orlynvah should not be used for complicated urinary tract infections (uUTI), or as step-down treatment after intravenous antibacterial treatment of uUTI. It should not be used for complicated intra-abdominal infections (CIAI), or as step-down treatment after intravenous antibacterial treatment of CIAI. How does Orlynvah work? Orlynvah contains Sulopenem Etzadroxil, a prodrug, which is converted into Sulopenem, the active antibacterial, after oral administration. Orlynvah has two mechanisms of action. Sulopenem Etzadroxil gets converted in the body into Sulopenem, the active antibacterial. The Probenecid mechanism of action is by reducing the kidney clearance of Sulopenem. This increases the blood concentrations of Sulopenem, making it more effective at improving the uUTI. What is an uncomplicated urinary tract infection? Uncomplicated urinary tract infection are infections bladder or lower urinary tract that occur in women without any structural abnormality of the urinary tract, and no other health issues such as diabetes, an immunocompromised state, recent urologic surgery, or pregnancy. Symptoms of an uUTI are increased urinary frequency, urgency, suprapubic discomfort, and painful urination. Complicated UTI are any urinary tract infection in males, patients that are immunocompromised, pregnant patients, and patients with fevers, stones, sepsis, urinary obstruction, catheters, or infection that involves the kidneys. Orlynvah side effects. Common Orlynvah side effects. Common Orlynvah side effects are diarrhea, nausea, vulvovaginal fungal infection, headache, and vomiting. These side effects occurred in 2% or more of patients in clinical trials. Serious side effects. Orlynvah side effects that caused patients to discontinue tablets included nausea, diarrhea, as well as abdominal pain, gastroesophageal reflux disease, vomiting, and dizziness. Allergic reactions, including serious allergic reactions, could occur with this medicine. Serious allergic reactions require immediate treatment. Patients should inform their healthcare provider about any previous hypersensitivity reactions to Orlynvah, other beta-lactam antibacterial drugs, or Probenecid. Who should not take Orlynvah? You should not take Orlynvah if you have a history of hypersensitivity to the components of Orlynvah, Sulopenem Etzadroxil, and Probenecid or other beta-lactam antibacterial drugs, known blood dyscrasias, uric acid, kidney stones. How should I take Orlynvah? Orlynvah tablets are taken twice daily, with food. Complete the full course to reduce the risk of antibacterial resistance. Orlynvah dosing information. The recommended Orlynvah dose is 1 tablet 500 mg Sulopenem Etzadroxil and 500 mg Probenecid twice daily. Dose and renal impairment. Orlynvah is not recommended in patients with creatinine clearance (CrCl) less than 15 ml min or patients on hemodialysis. No dosage adjustment is required for patients with CrCl greater than or equal to 15 ml min.